Hello, my name is Cate Fitzgerald and I'm the Statewide Clinical Education and Training Program Manager for Occupational Therapy in Queensland Health. This presentation is second in the series on clinical decision making. It discusses the factors influencing clinical decision making in practice. According to the literature, a range of factors influence clinical decision making, and for this presentation I have grouped them into four main categories. Firstly, the context of care. Secondly, the client and their life context. Thirdly, the profession's theory and science. And finally, the personal beliefs a health professional may hold about their practice. These factors are interrelated and guide clinical decision-making to varying degrees as the health professional engages with clients and their professional colleagues in the environment of care. Let's now look at each of these categories in more detail. Within the context of care, that is the practice setting of the health professional, a range of factors influence the conditions for care or guide or constrain care. For example, clinical guidelines provide support to the way care is delivered and therefore influence clinical decision making. Other examples are professional standards for practice, the profession's and organisation's code of conduct, and the organisation's values and drivers for care. Clinical decision making is also influenced by the client and what they bring to their care. For example, the client brings their experience of their illness, their condition or disability. They bring their cultural and social beliefs, who they live with, their home environment and what is important to them and what they value. Attending to the client and their life context influences clinical decision making and is an important consideration for healthcare professionals. The clinical decision-making of all health professionals is influenced by their knowledge, informed by their profession's theory and science. Health professionals also bring evidence on how this theory guides their professional reasoning and decision-making. Theory refers to the ideas and concepts guiding profession-specific reasoning, and science refers to how the professional translates evidence into practice and how this underpins their clinical decision-making. Finally, the personal beliefs of the health professional guide how they reason in practice. The professional's beliefs they have about themselves, others, and their profession are unique to them, and they all contribute to defining the acceptable behaviours arising from their decision-making within each care context. When reasoning in practice, a health professional draws upon the factors discussed previously, and they integrate all that information. They weigh up the evidence that's drawn from research, theory, their clinical expertise and the individual client. They then critically appraise all the information, apply the different types of knowledge and reflect upon goals and plans for care within the practice context. They do all this to make a decision for current and future professional care. The process used to integrate all of these factors and actions is clinical reasoning. As you can see, there is a link between evidence-based practice and reasoning in practice. Within healthcare context, clinical decision-making can be derailed due to unexamined risks to effective clinical reasoning. These risks may be inherent within the environment of care or the individual health professional. Examples of these risks are when the health professional fails to be curious, when they make decisions without examining emotions that arise for them and others, or when they take mental shortcuts in patterns of reasoning, known as low-level heuristics. Other examples are where the health professional relies on their patterns or habits of reasoning without reflection. This poses a risk as they may then not notice points of difference in how the client is presented or how the client is currently presenting within the healthcare environment. If a health professional maintains a perspective contrary to the evidence from theory, science, or another source such as their colleagues, or if they do not communicate their reasoning for care well to the client or healthcare team, then clinical decisions may also create risks in care. Awareness of why and how clinical decision-making may be derailed assists health professionals to be mindful of not only the factors that influence clinical decision-making, but also how they notice and respond to these factors. Reflection may assist with the development of this awareness. In addition, awareness of how a health professional reasons in practice is important to reflect on, and this is explored further in the next presentation in this series. In the meantime, here are some questions to reflect on related to the content of this presentation. Can you think of examples of how each of the 4 factors presented currently impact on your clinical decision making? That is, the context of care, the client and their life context, the theory and science of your profession, and your personal beliefs as a health professional. It may also be helpful to reflect on what you usually do if your knowledge base isn't adequate to inform your clinical decision making, or how the patient or client influence your decision making. You may choose to reflect on your fundamental beliefs and how they differ from those of your colleagues of the same or from different professions. And finally, how in the future will you notice if you have developed patterns of decision making that could create risks to your care? Thank you for these reflections and for listening to this presentation.